When my parents and I would go visit my grandparents as a kid, I would always feel so excited to tell my grandma about how well I was doing in school. She would always have a smile on her face when I brought up my achievements and the path that I was taking, and it made me feel special. Out of nowhere, she started showing signs of memory loss and confusion. In a span of 3 months, I watched her body slowly lose the life that I used to remember. My grandma passed away from GBM. She died 7 months ago. A lot of people I talk to don't truly know what GBM is, but I think that people should take the time to understand what GBM is, how it's diagnosed, and the treatments and research that are conducted to try and find a cure. First, what is GBM? GBM is glioblastoma multiforme, and according to mayoclinic.org, it is a type of cancer that originates in the brain or spinal cord from the rapid cell growth of astrocytes that affects the nerve cells in the brain. Similarly, GBM is often mistaken for a condition such as a nerve tumor or a pinched nerve called a neuroma. But nevertheless, these two conditions both exhibit a patient's loss of motor function with their body. Medical doctor Dr. Lipinski, who works with patients diagnosed with GBM, explains the descriptions of pain in an article from the Roswell Park Comprehensive Cancer Center. He explains they are often described as dull, pressure-type headaches, though some patients also experience sharp or stabbing pain. GBM affects each patient in a different way, but normally it starts in the brain as a rapid growth of cells that clumps together to form a tumor. With time, simple cognitive functions become so difficult to a point where the patient can't learn properly, make decisions, and concentrate. With progression of GBM, those processes become even more challenging due to the ongoing functional loss and increasing intracranial pressure of the skull. According to the Brain Tumor Charity, the average glioblastoma survival time is around 12 to 18 months. Only 25% of patients survive more than 1 year, and only 5% of patients survive more than 5 years. Over the many years of research, there is still no identifiable cure for GBM. In addition, the symptoms related to GBM usually become more apparent with time, but in general, the disease is difficult to diagnose. Many of the symptoms can go unnoticed at first. For example, many of the common symptoms start off with a minor headache, but with more time, those symptoms become more objective to the point where a doctor or a relative to the patient can easily notice symptoms like confusion or memory loss. If kept unchecked, the patient may start to experience seizures, changes in mental function, and nausea, indicating the severity of the disease. The first step in diagnosing GBM is with an MRI, which is followed by a biopsy. With the biopsy, it is then sent over to a pathologist to determine if the cells are cancerous or not. Furthermore, once the disease is diagnosed, there are many treatments that can help slow down the progression of the tumor. For treatments, the most common for GBM includes surgery to remove the tumor, but with the uncontrollable rapid growth of the tumor, it may not always be the first option people choose. Other treatments like chemotherapy, where the patient is given strong medicine, and also radiation therapy, where the cancer is treated with an energy beam, are both heavily practiced and studied treatments that can lengthen the lifespan of a patient with GBM. But with these treatments comes with feeling sick because of the strength of the medicine. My grandmother chose not to get treatment, but in a way, I kind of understood. Her diagnosis was already in the last stage, and it had already metastasized and attacked other organs. With the many treatments available, there is ongoing research on finding new ways to attack brain tumors. Of all these treatments, one problem that doctors face is the blood-brain barrier, which blocks a variety of drugs that can't get through the barrier to treat the tumor. According to ivybraintumorcenter.org, 78 investigational brain tumor drugs were evaluated in advanced clinical trials, but only 3 gained FDA approval. Of these, temozolomide, an oral chemotherapy, has been the only one to show a survival benefit. Patients are able to take these treatments to expand their life, but only for a temporary amount of time. Lastly, GBM is a genetically heterogeneous disease with no cure. I believe that people need to understand what it is, how it's diagnosed, and what treatments can be given. People diagnosed with GBM are always on the brink of facing death, and with the clinical studies, with new treatments, and heavily backed research, we are one step ahead of finding a cure.